just joining us, who just entered, just settled into Lagos State and doesn't know what Ilera Eko is and what Lashma does, can you just do a little recap?
Okay. Lashma is into health insurance plan. It is into a social health insurance plan. So what we do basically is we sell insurance plan for Lagos residents so that they will be able to access healthcare wherever that is close to them. So we have hospitals empaneled in areas that are very close to everybody. So definitely you will definitely see an hospital that is empaneled and very close to your area.
Okay.
So you can access healthcare, you can also access drugs. So majorly we're into health insurance plan.
Okay, so there's a new baby, the Ilera Eko Standard Jara. Could you tell us about it and how affordable this is?
Okay, so the standard Jara plan is actually very, very affordable because for an individual, you just have to pay 15,000 naira. For a family of 4, which consists of a father, mother, and 2 children under the age of 23 years, you just have to pay 55,000. And for a family of 6, we have the father, mother, and 4 children under the age of 23, and you have to pay 80,000 naira. So you see, it's quite affordable.
It does sound quite affordable. Let's talk about the Ilera Eko telemedicine service. What is this?
Telemedicine?
Tell us a little more about that.
Okay, so the telemedicine platform or the telemedicine service is just a platform or a channel where people can access healthcare services, non-emergency healthcare services at the comfort of their home. Like you just have to call the health hotline and you speak to a doctor, or you download the app and speak to a doctor, but you have to be enrolled under the Standard Jara plan before you can access the healthcare.
So, very interesting.
Yes, so we also have the V-booths at the 5 Ibile divisions. We have at Ketu Fruit Market. We have at Adamo Market. We have at Saboyaba Market. We have at Ayetoro Market in Ekpe, and we also have at Ikorodu, Sabo Korodu Market.
You call it the V-booth. What is that?
Okay, so it's like a shop where you walk in. We have the nurses there. They will attend to you for non-emergency cases, actually. So yes, so probably you have malaria and you're around the market, or you probably have headache or cough. You can actually just walk into the V-booth, and then the nurses will attend to you. And if you need to speak to a doctor, they will book a consultation for you. So also via the hotline, you can easily call the hotline and you give them your policy ID as an enrolled person, and your plan is active. So once you pay for the plan on or before 25th of any month, your plan becomes active the first week of the next month. So if you pay after 25th, your plan will not be active until the next month.
Okay.
So yes, you have to pay on or before 25th for your plan to be active the next month. So once you have an active plan, you can easily call the toll-free line. It's a toll-free line. You just call the hotline, and then you can book a consultation to speak to the doctor. And you can also download the telemedicine app. We have a telemedicine app. It's called the Ilera Eko Telemed app. So once you download it's on Google Play Store. We have it on Apple Play Store too. So you can download it. You book the consultation at a time that is comfortable for you. Then the doctor will place a call through to you.
So if you're under the Ilera Eko Standard Jara plan, are you do you vie for that opportunity to actually be a part of the telemedicine plan as well? Is it a different plan?
Yes. You are not paying any extra charges once you pay for the plan.
Okay.
You can access the telemedicine service.
Okay, and you said that we go to the V-booth to have a conversation with nurses
in case there's
an issue.
Yes, but non-emergency cases.
So it has to be non-emergency cases.
Yes, it has to be non-emergency cases.
So
you can also go there for enrolled people. You can go to the V-booths if you're a known diabetic or hypertensive patient. You can go there for your weekly routine checkup. You can just go there. They will check your blood pressure. They will take your blood sugar level. So they can do that for you every week. You can go there for that. Then you can also get health education from the V-boots, from the nurses. They will health educate you on the necessary things to keep yourself healthy.
Okay. So a quick one, just so that we're all clear. If I try to subscribe right now, say the 29th of April, does my subscription start today, or I have to wait until the 25th of the month before it starts counting?
Okay, so like I said earlier, you have to register you have to pay for your plan on or before 25th of any month.
Okay.
So like now, if you want to pay, like now, you can pay for your plan this month, but it's not going to be active in May. It will be active first week in June because you didn't pay on the 25th of April.
Okay.
So you have to pay on or before 25th of any month to be active by the first week of the next month.
Okay.
Telemedicine, because that's the focal point of the conversation that we're having today. That is, you avail us the opportunity to call a doctor and maybe explain our symptoms. But in all of that, if I wanted to get drugs, maybe the doctor had prescribed medication for the ailment that I may be treating at that time, how do I get it?
Okay, so to get your drug, if you go to the V-booth, once you are done with your consultation, the doctor is going to send your prescription to the nurse. So she's going to so the nurse is going to give you a prescription note that you can take to the empaneled community pharmacies, which you can get your drug. It can be a community pharmacy that is empaneled under Ilera Eko.
And it's for free?
Yes, so you get your drug. But if you call the hotline, your prescription will be sent to the number that you used to register.
Okay.
So you take the prescription and your policy ID to a community pharmacy close to you. So you get your drug too. Same with the telemedicine app too. Your prescription will be sent to you via the number that you used to register.
Oh, that's so
interesting. It is very, very easy to get your prescription. It will be sent to you, and then you just go to the community pharmacy to get it.
Okay, so under Ilera Eko telemedicine service, I wonder, just so that you stipulate clearly, what are the health services that are available through the telemedicine and the ones that are not available?
Okay, like I said earlier, so we have non-emergency cases. Those are the cases that can be attended to via the telemedicine platform, such as probably you have headache, you have cough, you have flu, you have malaria, you have skin rashes. You can just go to the V-booth, like I mentioned. Probably you're in the market and you feel like, okay, I'm probably feeling stressed or tired, or I'm having a headache. You can just walk into the V-booth and you speak with the nurse. Then if she feels like you need to speak with the doctor, so she's going to book a consultation for you. And then if you need to be referred to the hospital, you will definitely be referred. If you've done your test and you need to review your test, you can also take it to the V-booths. Then they book a consultation for you to see the doctor. So the doctor can review your test for you via the telemedicine service. So, but any emergency cases such as asthma attacks, seizures, road traffic accidents, you cannot access services on telemedicine platform. So you have to go to the hospital.
Is it 24/7, the telemedicine services? Is it 24/7?
Sorry, I didn't get that.
The telemedicine service that's available, is it available 24/7, or are there specific times for consultations?
Okay, so actually on the hotline at the telemedicine app, you can access healthcare 247. Like you can book your consultation to a specific time that is comfortable for you. And also for the V-booths, you have to be at the V-booths between the time of 9 a.m. to 4 p.m. Mondays to Fridays. Those are the times.
All right. You mentioned that you can avail, or we can access Ilera Eko Standard JARA, or rather the telemedicine service if we're part of the Ilera Eko Standard JARA. Are there other things that we need to do or someone needs to do to actually be a part of the telemedicine service?
No, once you have your standard JARA plan and your plan is active, you are good to go.
And that's it. Okay.
Yes.
You know, one of the things we love about Ilera Eko is that you were very intentional about getting across to not just, the high and fly, but the grassroots as well. So say for this telemedicine, someone doesn't speak English. How will they be able to consult a doctor and then get their prescriptions?
Oh, that's very good. Like you said, we try to make things very easy and simple. So for those who don't speak English, we have other languages such as Yoruba, we have Igbo, we have Hausa, and we also have Pidgin. So once you dial the toll-free line, you'll be given the options of the language that you want. And once you get to the V-boot, you can also tell the nurse the language that you prefer. So once you do that, you'll be spoken to in the language that you prefer. So not necessarily English. We have Yoruba, we have Hausa, we have Igbo, and we also have Pidgin.
Awesome.
Okay, could you kindly reiterate where these V-booths are at the strategic location so that people who are listening right now, anyone who's listening right now wants to be a part of it, can walk in?
Okay, so we have at the fruit market in K2.
Okay.
We have at Ayetoro market in Ekpe. We have at Saboyaba market. We also have at Adamo Ikorodu market. We have at Sabo Ikorodu market. So those are the 5 locations for now.
Okay, and anyone who wants to be a part of the Ilera Eko Standard JARA can walk in and get information, right?
Of course, once you walk into the V-booths, if you want to get enrolled, you speak to the nurse, then they will enroll you.
Okay.
You pay for it.
But for those who are still just listening and saying, you know what, I want to do it online, how can they register? How can they activate a standard JARA plan online?
Okay, so on your own, if you want to register for the plan and pay, you can download the app.
Okay.
So you just put in your information and then it will give you your policy ID and then you pay. You pay on the app.
Okay.
Oh, that's awesome.
Okay. So we've been speaking to the Digital Health Officer, Lashma, in the person of Miss Olamide Oladiti. Well, one question before we go on this rather short break. I wanted to ask, how has the digital process been so far with Ilera Eko? Because I know we're getting into the digital world. So, I mean, how has it been?
Sorry, I didn't get that.
Can you hear me?
Yes, I can hear you now.
I said, how has the digital health office department being a part of Ilera Eko? How has the digital process been? Has it been embraced by people? Do they find it easy? What's the process like?
Okay, it's been very evolving. Before you can access.
I think we've lost
You're
you.
a little
We can't
muffled.
hear you properly right now. Don't know what just happened.
Oh,
Okay, we can hear you now. Yes, we
Yes.
can.
Oh, okay. I said, it's evolving. Before you access healthcare, before you have to go to the hospital. But imagine now, at the comfort of your home, you can just call, and then you can speak to a doctor. Like, imagine, it's like we are living large now. Yes, it is. Imagine having access to that kind of platform.
Yeah.
It's usually outside the country that you can do something like that. But imagine Lagos has something like that. You can be at the comfort of your own home, and then you can speak to a doctor. You don't have to go out. You just put a call through, and then you access healthcare. Then your prescription, or if you have to be referred, you get any of that. So it's evolving, and it's quite amazing, actually.
Awesome. Okay, if you are just tuning in, we're talking to the Digital Health Officer, Lashma, Miss Olamide Oladiti. We're going to take a quick break. When we come back, 1 or 2 bits of information I'm sure she still wants to give us, and we'll be on our way. So don't go anywhere. Stay put, and we'll be right back.
Carol, come on. You don't hear say Lashma don't bring V-Boot come with market.
Now who be Lashma?
Lashma na Lagos State Health Management Agency. The people will bring Ilera Eko.
Oh, okay. The social health insurance people. But what you come consign us with V-Boot?
Carol, V-Boot na the online online store where subscribers fit get telephone healthcare talk with Dokita. Dem don station all these VPUT stores dem for all the big area markets throughout Lagos. People wey don already pay down for the standard Jara plan go enjoy all the better benefits of the old standard plan together with the new extra jollyment.
Abeg, tell me say this talk na true.
Just dial *6700 *006 hash to join standard Jara one time or call 0700 Ilera Eko. You fit also send WhatsApp message to 0704 535 8275 or register online for www.lashma.com. Ilera Eko, nobody go carry last.
You are listening to Super FM.
More than just a sound. You can add your mood booster and yourself some great vibes. This is Super FM.
It's still 92.7 Super FM, your one family, one radio. It's 10:23 a.m., Tuesday, the 29th of April, 2025. And we have had the pleasure of speaking with Miss Olamide Oladiti, Digital Health Officer at Lashma. And yes, we're talking Ilera Eko. Every Tuesday we talk Ilera Eko.
Yes,
because
very important.
health is important. And Ilera Eko is the wellness of Lagos. And we've been talking about the telemedicine service that's available to everyone who's a part of the Ilera Eko standard Jara plan. That is, you can be in the comfort of your home and speak to a doctor and consult with them on non-emergency issues. Headache, cough, malaria, and I mean your prescriptions can be sent to you via the phone, and all you need to do is go to the VBOT that is available at strategic positions here in Lagos,
or the community
pharmacy
that is
registered under Ilera
Eko,
and pick up your medication. Easy peasy lemon squeezy. You know, you don't need to see the four walls of like hospitals. I mean, this is good, right?
Olamide, I know you're still here. Just share with us, in case someone is listening to us for the first time, what exactly is available to you under the standard Jara plan?
Okay, so under the standard Jara plan, we have general consultation.
Okay.
We have you can also see a specialist, but that is limited to 4 times in a year.
Okay.
Okay, so you can see an ENT surgeon, a pediatrician, a general surgeon, dietitian, a gynecologist, family physician, also a cardiologist, and also orthopedics. So we also have treatment for common ailments such as outpatient care, malaria, acute, uncomplicated febrile illnesses. So you can also be treated for childhood illnesses.
Okay.
Then we also have eye care. We have family planning services. We have children welfare services. We have hospital admission care. We have pharmaceutical care. We have blood transfusion. We have chronic diseases care. We have services for HIV. You can do your football counts, your malaria parasite test, genotype. You can also do your resource factors test also. Then we have chemistry tests too, such as random or fasting blood sugar. You can do your electrolytes test, pregnancy test.
It entails a lot.
Quite a lot.
Yes. So you can also do your microbiology tests, such as sputum MCS, your MCS for urinalysis, semen analysis. You can do bacteria pylori test.
Don't see, Olamide, don't even worry. That's why it's only the medical practitioners that know how to cross on all those things.
Understand stuff like that. Yes, so it
awesome.
really covers a lot. You can also go for your dental care too. You can go for surgeries, your CS. For those who have hernia, appendectomy, you can go for that. You can also go for urinalysis. So we have a lot under the standard Jara package.
Awesome.
And you can also access the telemedicine too without having to pay
Pay
extra cost.
extra. Oh, now
awesome.
that's amazing.
That is
That
beautiful.
is amazing.
Because if there's the option of I can't go out, but I need to ask questions to know how urgent this is, I can speak to a doctor over the phone and they can say, oh, go to your hospital right now because whatever you're saying right now is more serious than you think. Okay. We've been talking Ilera Eko telemedicine service. And if you haven't gotten on board to register for the Ilera Eko, which is the health insurance scheme, how can one do that right now? You said the app. What is the name of the app? Where am I going to find the app? And then what
The number to
email
call.
address and what else do I need?
Okay, so you can download the app if you have an Android phone via the Play Store, and if you have an iOS, you can download on the Apple Play Store.
Okay.
So once you download the app,
What is the name of the app?
Oh, Ilera Eko Telemed app.
Okay, Ilera Eko Telemed app. That's the name of the app that you need to download.
Yes,
Okay.
Ilera Eko Telemed app. So once you download the app, you register, then you can pay for your plan.
Okay.
Awesome. What's
Okay,
the
so-
last? Okay, yes.
So if you want to call our office, you can call us on 070
Okay.
045372 5356.
Say that again, please. Let's for everyone who's listening.
0700
Okay.
545
Mm-hmm.
72 356.
Okay. So 0700 453 7278.
No, 0700 453 72356.
56, yes.
Okay. All right.
So you can also reach out to us on WhatsApp. The line is only for WhatsApp messages.
Okay.
We have 070 453 582
Okay.
75.
58275.
So I'll
That's
call
the
that
WhatsApp
once
number.
again.
Okay.
070 45 35 82 75.
All
Okay.
right. Just
Thank
for
you.
safety, we'll call the numbers again. If you want to call to find out any more information about Ilera Eko, it's 0700 453 72356. But if you want to send a WhatsApp message to them asking anything regarding Ilera Eko, it's 0704 538 275. Did I get that correctly?
070 453 582 75.
Yes. Okay.
Awesome. Thank
Thank you so much, Miss Olamide Oladiti, who is the digital